by V-Care Home Health, a leader in providing home health services throughout the entire DFW Metroplex. Doc Talk Live is also sponsored by Dallas Renal Group, a physician group that myself belong to. Dallas Renal Group provides comprehensive kidney care, including transplant and home dialysis services. Information can be found on dallasrenalgroup.com or our Dallas Renal Group Facebook page. My name is Dr. Sylvie Simon, and I'm here live in the studio with Dr. Jaremy James and Dr. Tanvir Ahmad discussing the influenza epidemic and pneumonia. The number to the studio is 972-235-5555. Again, the number is 972-235-5555. To be a part of the conversation and ask your questions, please do call us here at the studio. So during the break, we had a question from Neha. She asked, a lot of people have been, as we know, have been diagnosed with the flu, and a lot of them are now, they have to go back to work, to the workplace. When is it appropriate to return back to work? When is it they're not in the infective period? And also, even if they do return back to work, both ways, how can we prevent the spread of flu and prevent getting flu? Dr. Ahmad?
So usually the infective phase we define when you are shedding virus. And that is starting a day before your symptom starts. You are infective, contagious, and usually up to 4 to 5 days after the symptom starts. So that is the time frame, about 6 days you are contagious. Sometimes if your immunity is slightly low or you have some other medical problem, contagiousness could be a little longer. But for all practical purposes, it's around 5 days from symptom start. So in that time period, usually you should avoid interacting or close contact with other people. And once the fever resolves, about 24 hours after that, you can have close contact and you are usually not contagious. And even if the flu is so rampant that everywhere you have exposure, so for prevention, basically avoiding close contact with sick person. If you are sick, do not interact closely with other people, and hand washing, and if there is any surface which could be contaminated by respiratory secretion, so that needs to be wiped. And of course, flu vaccine is a very big part of prevention.
Thank you, Dr. Ahmad. And these seem all like simple gestures, but they really do go a long way. Great. We had another question during our break. That was from Mr. Alok. He wanted to know, basically, with all the number of flu cases involved, a lot of them, were they involved with patients not taking the vaccine this year or in the setting of taking the vaccine? Dr. James?
Yes, just a great question, because we do have seen it such a bad year this year. I can only say from my own experience that I've had in my own practice that about half and half, or maybe even 75% have had the vaccine itself, and still came down with the flu, and about the other 25% still. And that's not to say that the 25% are more protected. It's because that 25% is probably about the percentage of patients in the community who probably didn't get the vaccine anyway. And so if you do get the vaccine, your symptoms should be much less severe, and so you might not have as high grade of a fever or some of the other symptoms that will come with it, the body aches that are severe, and so it can help a little bit with that. But if you didn't get the vaccine, and whether or not the vaccine prevented versus didn't prevent this year, like I say, it's been a bad year, and there's one virus that's been going around that wasn't necessarily covered under this vaccine this year that made it severe for many people out there this year. So it's to say that the vaccine might work or might not work, that's a difficult question, because every year it changes, and certain years it will be perfectly covered in very few illnesses, and other years like this, it's just no matter if you got it, you're still going to get some sickness.
Right. For those who are tuning in, this is Doc Talk Live. My name is Dr. Sylvie Simon, and I'm with Dr. James and Dr. Ahmad discussing influenza and pneumonia. The number to the studio is 972-235-5555. Again, that number is 972-235-5555. We'd love to hear your questions. So, doctors, going back to the flu, we talked about the symptoms and that it is definitely an epidemic. I mean, I think that is now obvious. But we would like to know, how is it even diagnosed? But before we get there, I'd like to take this caller first. Hi, welcome to Doc Talk. What's your question? Those are all great questions, Dr. Ahmad.
So, influenza A and influenza B are two different type of the same virus, and there is basically antigenic difference in their basic structure, but disease production wise they are more or less similar type of disease they produce, and there are some studies which shows influenza B is little less severe and they respond better to treatment, but more epidemic is from influenza A. So that is two different type of the same virus. And then your question was, is the human body capable of getting rid of influenza without treatment? And that is actually the case for majority of the people. The patients who are healthy, who don't have any chronic medical problem, they are less than 65 years of age or not very young, and non-pregnant women, they are perfectly capable of handling influenza by their own. They don't need treatment. What treatment does is it reduces the severity, and if you have risk factors, as I was discussing, if you have risk factors, then it prevents complication. You might not develop pneumonia and other complication from influenza. But for regular influenza, mild to medium symptoms, you are perfectly capable, and all the authorities, CDC and those places, they do not recommend treating with antiviral for healthy people who are capable of handling itself.
Great points, Dr. Ahmad. Let's take another live caller. Hi, welcome to Doc Talk. What's your question? You're welcome, and thank you, Dr. James and Dr. Ahmad, for really supplying us with this great information, because it really is an important topic to talk about. So before the caller came in, so how do we diagnose influenza?
So influenza is usually, if there is an outbreak like right now, you can diagnose influenza just clinically by the symptomatology and exposure pattern, and depending on as I was discussing just a little bit ago, that if there is no high risk factors involved and you are young and healthy, it is more of a symptomatic treatment. Keep yourself hydrated, avoid exposure to other people, and take some over-the-counter symptomatic medication. But that is in outbreaks. sometimes we do want to confirm even in outbreaks. So there are two types of tests available. One is through the antigen, which is in every physician's office. They will take swab from your nose and check it. It takes about 15 minutes and you get the result. It is about 60 to 70% sensitive, so you miss some cases of influenza with swab. There is another test which is more sensitive, but it is usually not used in the outpatient practice. In hospitals, if you are admitted, they use, it's called PCR. It is more sensitive. And so that's how basically you diagnose influenza.
Great. Guys, we're at Doc Talk Live listening to discussing flu and pneumonia. The number to the studio is 972-235-5555. Dr. James, now here's a common scenario or a misconception, if I could say, but can we get the flu from the flu shot?
That is a good question, and that's a question that comes almost daily when the flu season comes along. You should not and most likely cannot get the flu from the flu shot. And the reason is because we are not putting the entire flu virus into the flu shot. It is what we call it, just bits and pieces, if you want to say, of the virus, enough to build your immunity towards it so that your body can recognize it when it's there, so that it can take care of it and attack it and get your immune system to wipe it out, and so you don't get sick, or when you do get sick, it can't take care of it quickly enough. But to get sick from the flu vaccine is, I think, almost impossible to get. You can have other symptoms from the shot itself, and that may be just some of the preservatives. For example, the typical vaccine is produced in eggs, and so of course if you have an allergy to eggs, you may develop an allergy to the flu shot and have a reaction towards that, and that may seem like a sickness or some sort of getting ill from the shot, but it's not from the virus itself, and it is not usually the flu that causes that.
Good point. Dr. Ahmad, so then when should we get the flu shot? I mean, sometimes I feel like at the end of summer they're advertising for a flu vaccine.
So usually a flu vaccine is available in all the pharmacies and physician's office around October. So that is the time frame. Usually if you get flu vaccine, the immunity lasts for about a year. And so starting beginning of fall, in around October, you can start getting flu vaccine. You can keep getting flu vaccine if you are not vaccinated, especially during this season. It has just peaked according to CDC few weeks ago, so it is in a plateau phase. It is still not on a downward trend. So if you have not been vaccinated, you should still get vaccinated.
Great point. Let's take another live caller. Hello, welcome to Doc Talk. Sorry, there's a little bit of lag. Hi, what's your question? Yes. Yes, what's your question? Dr. J?
That's a good question. Unfortunately, the flu shot does not prevent or treat the illness that is happening right now. The flu shot is a vaccine, not a treatment. And so the vaccine is there to build up in your system so you build immunity prior to getting the flu virus in your system. If you did not get the vaccine beforehand, it will not fight the current infection of the flu. That's why we push this, and that's why we talked about getting those advertisements around summer to get it early enough to build that immunity in your system before the season hits real strong, to prevent that from getting out of hand for you, so you have that immunity built up in your system before the illnesses come. And so no, it should not, it will not prevent you or treat the current flu. You need to have that shot well in advance.
Great. And Dr. Ahmad, do you have anything to add?
So if you already have influenza, if it is fully diagnosed, then you will get a natural immunity from the infection itself. But it has to be, we have to make sure that it is not just a common cold. If it is a diagnosed influenza, you will get natural immunity. If it is not diagnosed influenza, then in that case, once you get over with your infection, you still should get flu vaccine.
All right, guys, I can't believe it, but we're at the end of our show. Please remember to check out our website, doctalklive.com, to get more information about the upcoming topics. Please do stay healthy, DFW, and we'll see you next week.